Those pregnancies, they all go on to do well, and okay, that's what we call like embryonic gestation. All right, and then you have what we call a missed abortion, where the woman is not bleeding, baby is inside, but baby is not alive. The heartbeat has stopped. All right, and then you have what we call an incomplete abortion, when the woman bled, had pains, but not everything came. For all these categories of patients, an evacuation will be needed to evacuate the uterus. Okay. So next slide. Medication, very, very important. In the first 3 months of pregnancy, you want to be very careful about what you take, the medications you use. And what we strongly advise is that women should avoid medications as much as possible and only use medications that have been prescribed by your doctor. All right? Prescribed, it is the main thing that you need at that very early stage. In fact, that folic acid, you would have started taking it like 3 months stage, and after that, you will stop. All right? If for any reason you are sick and we need to administer medication, we must ensure that it's a medication that is safe. For those who are who are hypertensive, who are on antihypertensive, we must make sure that the antihypertensive you are taking is what is safe. You may be taking an antihypertensive while seizures, epilepsy. There are women that have these seizures and they are on medications. There are women who have thyroid disease conditions and they are on medications. Whatever medication you're taking, we need to know and be sure that it is safe, and ensure that this nutrition, very, very important. It's important for you to ensure that you maintain a normal balanced diet. You know, a lot of patients say, doctor, I'm not eating the way I thought I would be eating. Eh? You understand? All right. So it differs. What you like, what you don't like, what you can tolerate, what you don't tolerate differs from one patient to the other. So what we often will say is that just follow what your body is saying. But what is important is that you must ensure that you eat balanced. Your diet is balanced. A lot of fruits, vegetables, water, carbs, protein, sleep. You don't want to see that food again. It's not something else. All right? You may ask your husband to bring something for you now. Do you understand? It's something that is to be expected, because these things will change. All right? So things potash. All those ones who that like eating kwabi, all those local Eastern delicacies, those things that you need to use potash for. Please, for now, while you're pregnant, in that early stage, you avoid the mark. All right? As the pregnancy advances, your appetite will change. All right, for those who were not eating before. Now, if you're having hyperemesis gravidarum and you're having all of those symptoms of pregnancy, it may affect your eating habits. But once you're done, your appetite will improve, and then you discover that you start eating well. Some people may lose weight during that first trimester, particularly if it was so bad and you're in the second trimester and then third trimester. All right. So for other tips, lots of rest, and then make sure you, for those who are on luteal support program, make sure you take your luteal support, and then once you are done with the luteal support for doing spontaneously, we say that after the second missed period is when you should register for your antenatal care. All right. And after the luteal support, many of you may need to have what we call a cervical sacrilege at the end of that first 3 months, that first trimester. And why do we do cervical sacrilege? We do it as a routine for most of our patients who got pregnant through IVF. Why? Because of the way you got pregnant situation. But just to say that sometimes that's the reason why we do these things. So I have a patient of mine who got pregnant spontaneously, carriages, about 6 weeks, 8 weeks, as a result of abnormalities with the baby or hormonal